Thanks so much for joining us. So what is the situation in Alberta right now with regards to COVID case numbers and the vaccine rollout?
Well, we're still continuing in Alberta, like the rest of the prairie provinces, to see a high number of active cases. We have over 1,100 active cases in about 37 First Nations, so that's on reserve in Alberta, and that's close to our peak. We watched the numbers very, very closely, and it looks like a small decline from last week. Unfortunately, we also know that we have 68 on reserve First Nations currently in hospital in Alberta, which is a very high number.
Do you guys know what is the cause for the sudden spike? Is it just that people were getting a little bit more relaxed doing the gatherings? Is there a theory as to what caused the spike?
Yeah, we have lots of theories. We have a lot of variety in the First Nations in Alberta. Some nations are very close and border on the big cities like Calgary and Edmonton. We know there's a lot of back and forth. And up until maybe 3 or 4 weeks ago, Alberta had almost the highest case rate in the country for a couple months. So the population prevalence off reserve, very, very high. We know that that's come down since the enhanced approaches put in by Alberta Health in mid-December. And so I do believe that we've had a situation post-Christmas and New Year's. There have been some gatherings. And in certain communities, we do see pandemic fatigue that you see off reserve. But the big factor, I think, is First Nations are reliant on their nearby cities and towns. They move back and forth. And even though there's a lot of restrictions in place, occasionally things get through and then you see a local spike in a community.
Yeah. We have a few questions from viewers that they wanted to ask you. Shannon wants to know, when should recovered cases think about getting the vaccine?
Yeah, that's a very good question. And in a time of vaccine shortage, we very recently said, you could consider deferring it a little bit. Now, each community in Alberta and across the country is actually going to have their sort of separate individual COVID-19 vaccination plan supported by Indigenous Services Canada, who I work for, also supported by Alberta Health Services and Alberta Health in Alberta. So a real big team approach, but each community is only going to get a smallish allocation, and they're going to have to decide if they prioritize those that have not recently had COVID infection, and it'll be different in each community. In a community where they've had very limited COVID-19 disease and only 1 or 2 people have had the infection, if your number comes up, I suggest you go ahead and get the vaccine. But some communities with a lot of cases are going to have to really treat this vaccine like the gold that it is, and maybe try and give it to someone else because the person who recently had disease does have some relative protection.
Yeah. Somebody else Starla asked, what are the recent side effects that are caused by the Moderna vaccine? And why, then the second part of the question was, why isn't the government making sure that everybody's aware of potential side effects beforehand?
Yeah, well, we're doing our best to communicate it out. There's no secrets. And as your listener likely knows, the initial vaccine trials were held in a large number of people, tens of thousands of people, but not millions of people. And so as the vaccine gets rolled out, we see certain signals, and most recently, and we do change the communication. So any vaccine has side effects. Every vaccine has side effects. Fortunately, the Moderna and the Pfizer vaccines are well known, and the only recent change that I'm aware of is a slightly higher risk of that very severe reaction called anaphylaxis. So we think of it as 1 in a million for most vaccines, but it is higher in certain vaccines. And for this one, we didn't see a lot in the initial trials, and now some evidence out of the States, it's likely 2.5 per million. So still very, very low, but anybody who gets a vaccine needs to be aware of the risk of anaphylaxis, and that's why we have processes, why we watch people after you get the vaccine. And if that becomes 3 or goes down to 2, it's still a very, very small number. The side effects we know about are common, and I call them basically nuisance side effects. You do get a sore arm, you do get some swelling and redness in a small portion of people, very manageable. Some people do feel a little bit unwell, very manageable. And so these are expected side effects. And we're watching really closely for those rare 1 in a millions. And so far, just anaphylaxis is looking a little bit higher.
Dr. Sarin, thanks so much for joining us today. It's always nice to talk to the doctors and ask questions and get some answers for us. So thanks for doing that for us.
You're welcome.